My name is Melissa Jones. I'm a registered nurse at Spectrum Health, and I have been there for 5 years. The cases that we saw in the beginning were so bad because we didn't know what to do. We didn't have remdesivir. The things that we were trying were just this is what we've heard works in Europe, or this is what we've heard that works over here. So we're just gonna try everything. And I don't think I've ever seen people that sick for that long. Families could have there was no visitation. Trying to help them feel okay about them not being there is one of the worst jobs that you could have. So I got COVID August 15 last year. So I got admitted for 2 days and got convalescent plasma. And then went home and with some super strong steroids and slowly started making progress, but it was probably 3 weeks before I could even get up and walk to the kitchen and back to the bedroom without having to stop and just being completely out of breath. When I came back to work, I had been gone for 6 weeks, so I felt like when I walked in, I would be invigorated and ready to get back at it. And I walked in, and it just was this overwhelming sense of dread of, I don't want to see this anymore. Having that feeling of when I couldn't breathe and when I had a hard time, and then looking at patients and saying, it's going to be okay, when part of you knows it's not going to be okay. And so took a different position away from the bedside altogether. I felt like a failure. I felt like I was weak and that I just needed to suck it up because everybody else was. That's how I identified. I identified myself as an ICU nurse. Taking that away and changing it to I'm an RN, but I don't take care of patients, is still a little difficult to reconcile. But waking up every day and not having that feeling in the bottom of my stomach of what am I going into next, knowing that I'm not going to have to hold anybody's hand when they're dying, and knowing that I don't have to tell anybody's family right now, is kind of makes it all a little bit easier. I have started talking to somebody about kind of what I went through in the ICU, and I remember her saying to me, have you ever been through trauma? And I was like, well, no, I've never been through trauma. And then she started going down the list, and I was like, oh, you don't feel like that's a label that you have because you just got up and went to work every day, and you took what was thrown at you, and you did the best that you could with it. I think anybody that has been in a hospital that has touched patients in this time has had trauma. And I think recognizing that and trying to say it out loud is very difficult.